Hi, dear friends. Welcome back to Humans of Healthcare. I might look a little bit different. I might feel a little bit more relaxed. There's certainly reasons for that. If you noticed, I'm gonna no longer be a VP at a corporation anymore. So I feel kind of free from representing a company. I just now represent what's right for humans of healthcare, and I'm completely 100% focused on humans of healthcare moving forward. So this new relaxed me with the hat backwards, it's just kind of more of who I am. And so this next interview is also more of who I am, but it's also very serious, right? So imagine you're a doctor and a CEO, and imagine in that capacity, you've seen everything behind the scenes with healthcare, and you're obviously dedicated to making it better. You want to help people. It's genuinely why you do it, right? And imagine your mom finally decides to have an elective surgery. She goes into the hospital for this elective surgery, and she ends up passing away from something contracted from the hospital. And again, you're privileged. You're a doctor. You're a CEO. You know people. You've got friends who are behind the scenes. There's no reason that should ever happen with all of the advantages that you have. And so you're shocked. You're blown away. And your regret is something that has to be reckoned with. And then the flip side, within a week, you get a call from a friend that one of your best friends, a great physician, has committed suicide. So the ugly side of the providers of healthcare, another doctor has committed suicide amongst the many doctors and healthcare providers, clinicians who commit suicide every day. It's a real problem. And so imagine you've always thought that you could do something about this. And imagine how helpless you might feel in that moment to know that you couldn't do anything to prevent what happened to your mom and your best friend, another great physician, gone. And then it hits you. It just hits you. And you have to do something different, because what you've done to that point has been more of the same. It's not working. It's never worked. And you go out and figure it out. You're smart enough. You have enough resource, and you really put the passion and energy into finding a solution. And you do. And here we are today. The solutions are out there. They're right at our fingertips. All we have to do is pay attention. And so I'm here to help Dr. Zeev Neuwirth help you pay attention to the fact that there's a better way. It exists. He's found the solutions. He spent 10 years of his life since that milestone where he felt so helpless. He's put all of his passion, all of his talent into finding a better way. And to his pleasure, to his surprise, the better way has already existed for quite a while. And so now my promise to him is that I would do my best, my measured best, to ensure that we at least pay attention on Humans of Healthcare to the fact that there's a better way. He's found it. It's in his book. It's on his podcasts. And in the interview you're getting ready to see is us two having a conversation about how it is today. But then we also talk about the other reality that nobody knows about. So as a healthcare executive, if you're watching this, please don't hide behind a rock. It's not going to turn out well when the rest of the public, especially us Gen Xers and the baby boomers who are coming through, learn that we could have had an option at some point to make it better, because the solutions have existed and they've been proven. And what are they going to think, or what are they going to say, and how are they going to come at us if we don't do anything to make it better? And if we deny that we knew any better, it's not going to be good. So please listen and let's pay attention. We can do something together by demanding better. So join me. Like this, share it. Let's do this together.
John, I've been in healthcare for over 35 years as a physician, a general internal medicine doctor, and then a manager, and then an executive. And about 10 years ago, 2 or 3 things happened which really made me pause and sort of reconsider the trajectory of my career and what I was dedicating my life to in healthcare. And I share that story in the preface of the book, Beyond the Walls. It's a hard story for me to even now, a few years later, even talk about. But the first thing that happened was my mother, who was pretty healthy, she ate well, she exercised, she had some problems with her hips, and she went in for an elective. That means a non-emergency total hip replacement. And she went to a great doctor at a great hospital, and she had her hip replaced, but she never made it out of the hospital alive. And she succumbed to a totally avoidable, preventable situation. And that episode, which took place over a few weeks' time, really left me and my family reeling. It was tragic. I mean, it completely changed our lives, changed our family forever. It is hard to describe, the loss of one's mother, what that means. And for me, particularly, I've been in healthcare for so long. My brother is a physician. My sister has been in healthcare for over 20 years. And despite the fact that we've all been in healthcare, we could not prevent the death of my mother. And what's even more tragic about it is if you look at the numbers, every single day in the United States of America, somewhere between 1 to 2,000. I just want to, that number is hard to wrap your head around. 1,000 to 2,000 people a day either get permanently maimed or die in our healthcare system from totally preventable, avoidable situations. If that existed in any other, could you imagine if every day 1 to 2,000 people died or got injured on airplanes? The industry would come to a halt, right? And yet, right? But that happens every single day in the United States, and the situation's getting worse. It's not getting better. And so that happened. A few months later, my primary care doctor, who actually was a good friend and a good colleague, an amazing physician, an amazing technology person, just brilliant human being, a lovely human being. I was sitting in my home office right here, actually at this desk, and on a Saturday morning, just catching up with some work before the family got up. And I got a text, and the text said, "Did you hear what happened to this person?" And I said, "No." And a friend of mine, another colleague, another physician, called me up, and he said, our friend, our colleague, committed suicide last night. Oh my God. And I never had that happen before. And this was a close colleague, a good friend, and actually was my primary care doctor. And I sat there for hours in this chair, this desk, and the thoughts that you have after someone whom commits suicide, I never would have predicted those thoughts. But I just remember sitting there thinking about my friend, thinking about my mother. And all of a sudden, I just started to shake my head. And I said, no, I am not going to continue to let this happen. Yep. And the truth of it is, by the way, in terms of suicide, every day in this country, 1 to 2 doctors takes their life. And the suicide rate in healthcare is so much higher than in any other industry. In fact, the fact is that over 50% of doctors and nurses, over 50%. That means when you go to see a doctor, you see a nurse, 1 out of every 2 of those people is burnt out. And that is a clinical term. That means they're depressed, they're demoralized, they're disenfranchised, they're depersonalized by the system. This is not a sideshow. This is what the system's causing. And so I had all of this, again, as an executive, as a physician manager, as a quality and safety officer, as a chief medical officer, all of that in my head. And I just said no. And I decided I was going to take a different path with my career. And that's what unfolded for me about 10 years ago.
Wow. See, that story, I mean, and everybody's going to have a story, but I think for some people, they'll understand like where you're coming from more acutely than others. But I think what resonates with me is that the passion that it inspired in you to do something, and then what you did with it. Because I think people feel that feeling, but then I can tell you from my experience, I don't know what to do with it sometimes. Like, how do you channel the passion, the anger, and whatever it is that's coming out of you? And then you went down a path that is, 10 years later, I mean, this is what you're doing is turning it into something good, it sounds like.
Well, that was exactly, by the way, that question you just posed, what can I do? I asked myself that question literally at this desk 10 years ago. And I ask myself that question every day. I think it's the right question. What I decided to do, and it's not dissimilar from you in some ways, I decided not to keep on studying the problem, because that's what I've been doing my entire career, studying the problem. And I took a different path, and I started to do something I don't even think I knew what I was doing at the time. I started to call up people around the country who were really actively creating a new healthcare. They were not talking about it, not complaining about it, not analyzing it. They were literally building a new healthcare. And I would get them on the phone. I would interview them, these in-depth interviews. Some of them were 2 hours long. Then I would transcribe the interviews with their permission. And then I would study. Literally, I would sit there. My wife thought I was crazy. This is after my job, my day job. On weekends, in evenings, I would study these transcripts, looking for the patterns. What was it that they were doing that was different from the mainstream of healthcare delivery in the United States of America? And at this point in time, I've interviewed hundreds and hundreds of these people who have actively. So this is not about the future. This is real. They all exist. These are companies and organizations that are taking a completely different approach to healthcare delivery. What I would label as a humanistic approach, and they're making healthcare better. Whether it's talking about care of the elderly, or talking about teens with suicide, or talking about women's health, or talking about prevention and chronic disease. And I started to collect those stories and study them. And the first thing that I noticed was there was a pattern. And so I wrote my first book, Reframing Healthcare, which was published in 2019. It was basically, here's the roadmap. Here's what these people are doing. And then a few years later, in fact, just in September, I published the second book, which you read, called Beyond the Walls. And this was a distillation. This was the strategy. I saw this strategy. I was like, my God, this is how the future of healthcare can happen. And it's basically 3 strategies. And each one of those strategies, I have dozens and dozens of real life stories of how this new humanistic strategy is emerging. And I'm happy to dive into that.
I think that's a great segue. So the idea is the strategy. Like, you have so much data that you had coming in, and then like, I like the way you described it. In real life, you have to figure out the time to do all this stuff, right? And so you're giving your effort in after hours, and so that to me is like pure. I don't know. It's just rings out as being pure, because that's your time after you've given all that you can give, and then from that, I think you probably have your best work. Then so you think about all of the ideas, and then I'm trying to simplify some of this stuff. How do we with the challenges that we face from reimbursements, all that stuff. I've seen a couple of interviews where you kind of dive into that, and it's really fascinating, because it's like this machine of healthcare. What is one of the top 10 GDP products that the United States has? It's a machine. It's like the government to me. And I know my little piece with technology, I have a hard time changing any aspect of it. And the ideas you're putting forth are big ideas that can have a huge impact, and make it healthcare, right? And so I'm curious, how do you distill down the simplest form, and how do you take it step by step, with a clear future about how to get from where we are today to where we should be?
Yeah. So I think the first point, and I think it's an important point you just made. Here's the thing. We have an amazing healthcare industry. It is, like you point out, it's nearly 1/5 of the US gross domestic product. I mean, our healthcare industry is the 5th. If it were a country, it would be the 5th largest economy in the world. That's how big our healthcare is. It's huge. And it's continuing to grow by leaps and bounds. It's actually, so it's an amazing industry in one respect. But here's the thing. There's a difference between an industry and a healthcare system. And while we have a huge healthcare industry with amazing science and medicine and technology and business models, what we don't have, and what the American public, what all of us need, and it doesn't matter if you're poor or rich, what we all need is a healthcare system, and that's what we don't have. And my purpose in outlining the strategies that I've done, distilled from this 10 years of research, my hope is that we start to actually convert the industry into an actual healthcare system. And again, I want to be clear. I'm in no way opposed to capitalism. I think what we need to do is make it so that capitalism works to keep us healthy, not to propagate sickness and disease, because that is fundamentally what we have. And listen, we have a sick care system, and it's important to a certain extent. What we need is a healthcare system. And that's kind of what I've been outlining in this strategy that I put in the book.
Yeah, that's exactly what I was hoping you'd kind of take us down that path. The part, like, I'm a simple person. Like, I think about the EMR, electronic medical records. I'm sorry. And so when you think about how long it's taken to really implement that and how often it was talked about before it actually came to fruition and there was regulations, like, it's been a long road. And that's something that's so, to me, fundamental and kind of basic. It just, to me, it illustrates how hard it is to implement some of these changes, So I think, with the idea and the strategy that you put together, like, what are the first steps that we have to sort of overcome, in your opinion? Like, how do we take that next step? And then from that step, hopefully we'll have enough energy to go to the next step. But, like, what first step would you recommend that we take?
Well, I think we have to do a couple of things at the same time. So here's the thing. So we have in healthcare a huge digital technology enabler, right? We have this industry of digital tech, and that includes now artificial intelligence. And on the other side, we have amazing business models, right? And they're evolving and they're changing, and those two are enablers. And so what we need to do is we need to take our digital technology and we need to take our business model excellence, and we need to actually direct them into a more humanistic system of care. And so again, this is not, in no way, shape, or form am I talking about going backwards. I'm talking about going forward into the future, using those enablers, using those positive, incredibly powerful tools we have. But they have to be directed in a different way, to a more humanistic cause. And those are essentially the three strategies: digital, business model, a revolution, and humanism.
Okay.
Now, let's get very, very concrete. So let me give you an example, right? So in terms of, like, humanism, and again, it sounds like it's a philosophic term or it's an ethical term. I'm not talking about it that way. I'm talking about very, very concrete changes. So, and here's what I, share in the book. These are things that you could adopt. So when you say, what can I do? First thing is, read the book, because there are examples after examples after examples of people who have actually done this. And you don't even have to make it up. You just can borrow it. You could adapt it. You could cut and paste. So here's an example: senior care. If you have a grandparent or parent, or if you're, elderly yourself, imagine this: you're 83 years old. You maybe have 6 to 8 medical problems, serious medical problems, which is not atypical. You are on maybe 10 to 15 medications, which is not atypical. And let's say, you might be in a wheelchair, because you might have had mini strokes or a stroke, you're hard of hearing. Even if you're not in a wheelchair, your balance is poor. You go into that same exam room, okay, that same doctor, that same exam room, as if you were 35 years old. There's nothing different about your care. Same doctor, same staff, same protocols, same resources. In what world does that make any sense? Because we know that an 83-year-old has completely different medical, clinical, psychological needs than a 35, 45, 55, or even 65-year-old. They're so different, and they're so much greater. That doctor's office is in no way equipped to take care of that 83-year-old. And by the way, that older population is the fastest growing demographic in the country. By 2032, there will be more people over 65 than under 18. And that shift is going to last for the next 4 or 5 decades. And so we are totally unprepared. And so what I've discovered is organizations that have said, you know what, we're not going to treat, older people with a lot of chronic disease the same way we treat a 35-year-old. We're going to get specialized and take care of that older person. And they've developed systems of care that are, by the way, cost effective. They make a lot of money. They have much better health outcomes, but they're focused. And so it's using that business model capability with a new payment model. It's using unbelievably sophisticated digital technology, because you can't do this in a mom and pop way. You need, like you were talking about, you need a new medical record system. You need artificial intelligence. You need machine learning. You need the technology to enable the care of the elderly, to make it cost effective, to make it efficient, to get the state of the art outcomes. So it's using those two strategies to do that. And again, hundreds and hundreds of examples, ChenMed, Devoted Health, Iora, Patina, CenterWell. I mean, dozens and dozens of organizations that have dedicated themselves to producing much better senior care using business model changes and using digital changes. And that's just with seniors. That's one issue.
Yeah.
I could tell you the same about women's health,
Yep.
And give you examples of that.
Yeah.
The care of children. I mean, you name it, on and on and on.
No, I like where the older population to me is front and center in my world most often. And I think about the technology, like you said, the technologies that already exist, the companies that are already there to service these folks the right way. And I do think, I guess the answer that I was kind of coming up with as I was thinking about your book and on all the stuff that we've talked about is attention. Get the right attention paid to the real issues. And what you've done in the book is really kind of distilled it down into a point to where, like, look, guys, this is happening already. And I think that's the biggest thing that as the general public looks at this is like, this works. It already has shown to work here, here, and here. Let's pay attention. And with the power of our attention, then maybe together, well, and I don't care how you get their attention, to social media, TikTok, doesn't matter to me. But once we get their attention, then I think we can get the power. And then I think the payment systems can change. We can get the political environment involved and have some I don't know, some rigor behind what we're trying to do here. But the attention to me is a big deal.
I think, John, you're spot on. And the bottom line is exactly, I think you just said it well. The answers are already out there. So I know so many people, so many organizations, so many of us are continuing to study the problem. And by the way, all good. We need the research, we need the evidence. But the problem is, by the time you figure out the solution, you're in a whole different, 5 to 10 years from now, the questions, the problems, the issues have changed. And so my approach is to say, we see things that are out there that are working, identify them, rapidly assess them, and then resource and scale them. That's a radically different way to create the future. And by the way, I do think that's how the future is created. And this comes down to one thing. This is about the healthcare that you can and should have. And it's not theoretical. And I mean, as I've been going around the country speaking, people come up to me afterwards, and what they tell me, and these are professionals, these are people in healthcare who've been in healthcare for 15, 20, 25 years. They don't talk about their professional side. They come up and they whisper in my ear and they say, Zev, I took my dad in the other day to the hospital. I could not believe it is so not equipped to take care of a senior person. Or, I took my child into the emergency room. I was shocked. They're sitting there for hours, days, or I went in. I mean, I can't tell you how many stories of healthcare people, professionals who come and tell me, you know what, I got sick. And then I saw the healthcare system from a whole different side. This is the thing. When you're in it as a patient or as a family member of patient, it's too late. And what I'm urging is we need to create the awareness, like you said. It's all about the attention, the awareness, the solutions are out there. And this is about the healthcare we all can and should have. And it's not going to cost us more money. In fact, it'll cost us less money.
Yeah. No, and that's the thing. I think in the general public wise, we innately sort of or inherently kind of understand that it's too expensive right now. There's got to be a better way. And I find comfort in what you said, that this way already exists. Even if we had to tweak it, but it does exist in a couple of different forms. So the work that we have to do to get there, a lot of it's already been done. So again, the easiest part of this for the public and the people who are watching this show, I mean, this is about healthcare workers. It's for healthcare workers. It's not about what they're doing wrong. It's about how do we help them, sort of have a better chance of their careers and do. I know what their hearts are. I know where their hearts are. I know what they want to be doing. Mm-hmm. And sometimes they're held back from doing the things that they want to be doing. You should see some of the stories on this platform where you have nurses coming on, you have CEOs, CIOs, and they're all telling about the same story, which is it's not working. Something's not working. And they're not negative about it. They're actually very positive about, their experience, but all the while telling a story about something that's just not working for them or their patients. And there's major concerns. There's crisis around how many doctors are available, how many are graduating. We have concerns about even nurses, all sorts of labor concerns, right? And those are the things that they're hearing out in the media and the general public. And so what I heard from you that was different when I found you, I'm glad I did it. It was through Scott Becker, but I found you, and then the book. I read the book. I'm like, this is exactly what I've been looking for, without knowing I was really looking for something. It was just like you said, a strategy and just the comfort that something already exists that we can kind of turn to. And I mean, you're right. There's many examples in your book about where to turn, and it sounds like there's some good people that are going to be waiting for us once we're ready to make that push. But the more we can get people to come together and make that push, I think the more powerful we can be and start getting those results. But I wanted to bring people to you because I think, you've got answers, and you can help usher us through. You've got the motivation and the passion to help us see this thing through. So anybody that's watching this, look, we've got it. Let's just come together and demand that we have something better. So when we get there, like you said, I love the way you said it. When we get there, it's going to be too late. We have to start now, make an investment in our futures, and take it very personally now versus waiting until we're hurting.
Well, it's, I know I've been on a journey, for 10 years and for a decade now. And now at this moment, as I listen to people across the country, like you were just saying, you listen to doctors and nurses, I will say what I see is a lot of learned helplessness. And, and it's, people are somewhat hopeful, but really not, because it's like, what can I do? Right. Well, I'm just a patient, or, I'm not an expert, or I'm not in healthcare. I'm just a doctor. I'm just a nurse. I'm just a CEO. What can I do? Right. And the journey I've been on, which I think for me, this is existential. This is, I'm not doing this because I'm interested in technology or business models. Yes, I find those things fascinating, but that's not what I'm doing it for. I'm doing this for my survival. I have been on a very, very intentional journey of learned hopefulness over the past decade. I have been talking to people who just are filled with hopefulness. And it's not about some theoretical thing. It's like, no, Zeev, look, we've built this. It works. The outcomes, we published on it. The science tells us we can do this better and differently. And it's not made up. It's not theoretical. It's all doable right now. And I continue to talk to people literally almost every single day, to record them, to interview them, these episodes of learned hopefulness. And to me, if we could have that narrative, and you just said it well, if we can point our attention, I think that's the most powerful thing. If you point your attention into the darkness, you're only going to see darkness. If you point your attention into the light, into the hope, then you will see hope and you will make it happen. I think that's what you and I are about. And for me, that's why I wrote the book. It's to bring it to people like you, to bring it to others, to say, oh my God, there is a way out of the American dilemma. Here it is, right?
Yeah, and they want to be led. The more I do this, it's my intention to lead. I've always wanted to lead, and I didn't know to what extent that I wanted to lead, but people want to be led. And so I think when we start connecting the people that want to be led with the people who are trying to lead, and I've always asked this since I started this, and I have no business being viewed by as many people as watch it. It's mind-boggling to me. I'm not the guy, but I can tell you the one thing that I've always asked is, okay, what am I going to do once I get their attention? And now that I've gotten their attention, it's like this big responsibility to put them in front of the right people, right? It's about the who's. Like you have the hows and other people have the hows, but it's also about the who's. Like, how can we connect the people who are interested and who, once we get their attention, to the right people? And that's just a responsibility that I feel. I'm sure you feel the same thing. You've done the research, you wrote the book. You're like, I'm not just going to say there's a problem. I'm also going to connect you with the solution. And to me, that's comforting. And I think if somebody gets from this interview, if you feel that comfort, that's great. But you also then got to go beyond the comfort, and you got to fight through it, because we actually need some action here. Or again, you'll be the one in the hospital bed, like, what the hell's going on? Like, why is this happening this way? I don't understand why it's so messed up, but it is. If you haven't experienced it, there's a lot of things that are messed up once you get in that hospital bed, or once your family member's in that bed. And behind the scenes, I see it all the time. there's things that just don't make sense. Like, why are we doing these things? And just on the simplest terms, like it's frustrating to see how
Well,
inefficient it is.
and here's another thing, as you talk about, as I visualize what you just said, we get into that hospital bed or so here's the thing, and here's another change we can make. And this is happening, right? It exists out there, it's scientific, it's evidence-based, and it's real. So we have a sick care system, and thank God we have the world's best sick care system. If you have a heart attack, if you have a stroke, if you have heart failure, if you have diabetes and you need hemodialysis, we have amazing science and technology and the best people in the world to deliver it. But here's the point. Wouldn't it be better if we could actually prevent you from having that heart attack or stroke? Not for nothing, but if it was me,
Right.
thank you very much. I'd rather not have it
Right.
than actually have to deal with your amazing science and technology. So here's the point. We need to start to convert what is predominantly a sick and disease care system into a wellness, an actual healthcare system. Now, that's the concept. And by the way, that concept has been written about. I can share with you white papers and actuarial science that backs up the fact that, number one, not only is a sick care system not good for people, it's also economically not viable. More and more people have chronic disease. The cost of chronic disease is getting higher and higher. We will not be able to afford it. We can't dig ourselves out of the disease hole. What we need to do is start to divert some of those resources into prevention, into wellness care. So there is literally now lifestyle medicine, functional medicine. These are bona fide healthcare delivery approaches. I mean, there's actually a board. You can get boarded in lifestyle medicine. There are doctors and nurses and others that are delivering this medicine, and it exists today. In fact, there are hospital systems now, like the Cleveland Clinic, that actually has a division of functional medicine. So this is bona fide. This is not, some, kind of
Right.
wacky thing.
Yep.
And what we need to do is, and to your point, there are people, there are organizations, there are systems out there that know how to do this. What we now need to do is take some of our resources from that sick care system and start to divert them into a well care system, into an actual healthcare system. That's another example. And by the way, this affects each and every one of us. In the country right now, there are 130 million American adults, 130 million that have a chronic disease, okay? Over 30 million with diabetes, hypertension. Almost 1 out of every 2 Americans has high blood pressure. We can't sustain this. We need to get ahead of it. And again, that's just another example of a whole topic that, we could talk about. And,
Well,
right?
like Doug, I'm obese, right? So I'm technically obese. I'm overweight. I've had some challenges with my history as well. I'm okay now, but it's like I wonder for myself, even just to be transparent with people
Yeah.
when I'm making decisions. Why do I make a decision that's not in my best interest, right? What's driving some of that stuff, and then would I really take advantage of the wellness, that opportunity if it were given to me? And some days, yes, and some days maybe not. It's just kind of depending on where I am. So from a personal perspective, I understand the challenge of getting people to buy into it. I mean, I struggle with that myself sometimes, frankly.
I grew up obese. I was what in back in the day they used to call it hefty. It was a nice way. I literally had to go to hefty stores to buy clothes when I was
Right.
growing up.
Right.
And so I know what it is. And here's the thing. Here's my take on this. And again, I've done a lot of research and study on this. I don't think this is individuals' fault or individuals' problems. I don't blame or put the responsibility just on the individual. It is very, very hard to be helpful if the system around you, if the environment around you
Right.
actually pulls you in the other direction.
Right.
And so when I talk about a system of healthcare, yes, it is having the right doctors and nurses and health coaches, no question, but making that accessible,
Yeah.
making it affordable. And it's the type of thing where it can't be that someone sits with you, John, or it sits with Zeev and says, hey, by the way, you need to do this, this, and this. Here, go ahead and do it. That's not the way it works. Okay. The way it works is you need the support around you. You need the environment around you. There's a whole science to this, by the way. This is not made up. I'm not talking off the top of my
No, I
head.
believe you.
There's a
Totally.
whole science of behavior change. We know the science. We know the technology. We know how to do this. What we need to do is to start to make it easy for you and me to be healthful. And so it's not about, and this, by the way, is what the system does, right? The system will blame you. It's like, how come you're not doing this? It's like, that's not the way it works. Okay. Most of us, there is a small minority of people who are fanatical about nutrition and diet and exercise. That's a small percentage. The rest of us, we need the right system around us to make it doable, accessible, affordable. And, most of us don't have the time or energy to do that.
Well, and the other thing you said before earlier, like about the elderly person that has to go in to the environment, the health, the sick care environment, they have to get there, right? And even getting there is a challenge. Getting transportation, all these things that we're not set up. We have, like you said, we have the technology, we have the resources to do it, but the system's not set up the right way to make it convenient for anybody to do anything. It's like every time I think about going in, it's like, oh my God, I got to schedule an appointment, which by the way is inconvenient for me. It's like, then I got to make sure I keep the appointment. It's like 2 hours, an hour, whatever it is away. It's not that far for my health, but it's kind of inconvenient, right?
Oh, very inconvenient. And, most people, I mean, the idea of taking off a half a day for a 5-minute medical appointment is ludicrous. I mean, who could afford to do that, right? Most Americans can't. And so, and that's actually in the book. I have a whole section about this where we have to shift the point of care to the point of need. It's where people are living their lives. And so again, this is not made up. People have been working on this problem for over a decade. And I give example after example of how healthcare is now moving into the home, even the hospital at home. And now this may shock people. I'm going to make this statement. It is much safer to get hospital care in your home than it is to get it in a brick and mortar hospital. The science and the evidence proves that. Less infections, less falls, less medical errors. Your length of stay is lower. Readmission rates are lower. Death rates are lower if you get a hospital delivered, in the home, and the costs of care are much less. This is the science, and it's been studied now for well over a decade that you can get better hospital care in your home, and again, it's more affordable. This is the reality. Most people are unaware of it, and this is why you and I are talking. This is why the public needs to know this, and I talk about it in my book. I have a bunch of chapters on this. It is so important to know this because you need to demand.
Yes.
You don't want to go into a brick and mortar anymore. You want that care delivered in your home. And it's totally, there are companies out there that have been doing this for years, and it's getting better and better and better. There are companies that do diabetes care, full 100% diabetes care virtually, not as good as in the clinical exam room, better. And so again, that's what I talk about in Beyond the Walls. It's if people knew this, they could get the type of health care that they need and they deserve.
Yeah, and when I read that, the feeling that I had is if I don't demand it, I'm actually contributing to the other side of it, right? So I'm being kind of complacent when I don't demand what you just described that we should demand. Very simply, in simple terms, demand this. Once you learn about it and you really know about it, you can ask for it, and they can give it to you because it exists. But if you don't, then you're actually contributing to the problem potentially by conforming to what the way it is. It's not working. So now I feel this responsibility to research, test things out, give it a shot, right? Because it can't be any more inconvenient than what I'm already going through. So like that's my take on it but since reading your book, right? I didn't know that existed. I didn't know that was a simple, potential for me or my dad or my mom. And they hate my dad hates going in. He just hates it. So, it prevents him from going in. And then all of a sudden he's having open heart surgery because he had, an EKG that took 2 years for him to finally walk into that could have been done at his house.
Right. Yeah, no, and again, these solutions exist. You could get the virtual care, you can get in the in-home care, whether it's urgent, primary, chronic disease management. Even, you talk about your dad, and I don't know how old he is, and I don't know his situation, but we know that loneliness is epidemic in older people. And it actually, if you have, by the way, it's not just that it's upsetting and it's sad and as a person, which it is, but if you have chronic loneliness as an individual, you are 26% more likely to die this year than if not. And so, again, so this is life-saving, literally life-saving. So there are companies out there that now have people who will go in, sit with your dad. We'll call up, we'll do virtual calls. We'll actually come in, take him out for a ride, take him to the pharmacy, take him to a store. There's one I talk about in the book called Papa, and they have these Papa Pals. And by the way, it is exactly what I described. Remember, I talked about the digital technology. This is the most sophisticated digital platform that makes this doable and scalable. It is a completely new business model, and it's humanistic. It's bringing people into older people's homes. They could play cards with them. They could help clean up a little bit. They can prepare dinner with them, and totally affordable, totally doable. And it exists. And it's Papa is one of the favorite ones. I learned about this company a few years ago. I love it. It's amazing what they're doing. There are others like it as well. And again, if people know about these things, like you said, you can make a decision and say, how come my employer is not offering this, right? And demand it from your employee health benefits, because you pay a lot of money. In fact, did you know that the cost of healthcare for a family of 4 now is $24,000 a year?
It's crazy.
It's crazy.
Yeah.
And this year it rose 7%. It is outpacing inflation, and it's outpacing wages, right? It is actually suppressing wages. I mean, can you imagine taking $24,000 a year for something, and then the next year it all goes away, and now you have to it's like buying a car and just throwing it away every year. Buy a car, throw it away. Buy a car, throw it. That's our healthcare cost.
It is. I mean, we have people who work at the company that I'm at now who are making 44,000 a year. Half of their entire pay is gone before they. I mean, it's gone.
That's
and
exactly
they
right.
can't afford. They just can't. They have to have it, but they still can't afford it. So yeah, it's insane what's going on.
John, I love that you said that, because it's so true. It's been written that our healthcare system is destroying the American dream. How can you get ahead if your healthcare costs are suppressing your wages? I mean, you can't get ahead. You can't have the American dream anymore. Healthcare is contributing to that. And I think, that's one side of it. Something we haven't talked about, which is really, really important, is the whole issue of disparities and inequities. Here's, the truth is, in this country, in every great city, the difference in lifespan between the wealthiest zip codes and the poorest zip codes can be 15 years or more. 15-year difference in lifespan between this is in the same city: Chicago, New York, LA, Atlanta, you name the city, the difference in lifespan. And that difference, that disparity it's literally, over the last couple of decades, it's increased by 600%.
My gosh.
There was an article in the Washington Post, an expose a couple of weeks ago, where they said that the best parameter of the inequality in the United States of America is no longer income. The best parameter is lifespan. Wow. And that is because of our healthcare system. Nice. And so we know today that the maternal fetal mortality, that is mothers and infants dying, around at birth, is 2 to 3 times greater in Black people than it is in white people. And by the way, that's not because of income. That's literally because of the color of their skin. The death rate amongst Black women and their children at death is not that different today than it was right after the Civil War. Okay, so this is shocking when you look at the actual statistics and the numbers, and we know this, and we need to be doing something about this. It is just wrong in our country that poor people, and I don't even talk about poor people, the number is over 100 million Americans are in medical debt. 100 million adults are in medical debt. That's not a small number. That's not 5 million or 10 million. That's over a third of the country. And by the way, many of those people will never, ever get out of medical debt. Nope. All it takes is one major hospitalization, and that's it. You will be in medical debt probably for years.
Yeah, because typically, if you've had a medical instance, right, you'll have no way to earn an income after that. And so, in a lot of cases, so you're stuck with debt, and you're stuck with no income as a result. So, I mean, and I love the idea, the way you talked about work, being at home, and what that could mean. And we've already, I don't know, you said we spent 65%, the total, like when you're at a hospital, 65% of what they're spending is going towards the plant or the facility. And if we could redirect those funds, they would have more, I don't know, they'd have more bandwidth to work with versus spending it all on some old hospital, right?
Well, that's exactly right. And this was told to me by an expert in the field who spent his career building factories. He said two things to me. He said, number one, like 60% of the costs of the hospital are in the infrastructure and the brick and mortar and all the stuff around that. And so we could save a lot of money if we delivered care outside in the home. And the second thing he said to me, he said, listen, I'm an expert in building factories. I built hundreds and hundreds of factories all over the world. The biggest problem in healthcare is that it's built on a factory model, and healthcare should not be a factory. People are not widgets. And he said that is the most misguided thing of all. And by the way, this guy who's brilliant and entrepreneur, made a lot of money, along the way, he had the same experience despite the fact of who he is. And he's been in healthcare for many, many years. Despite that, his father went into one of the most prestigious hospitals in the country and did not come out alive. And he could do nothing about it. And he said to me, he said, Zev, I'm on the same mission you're on. We have to, once you're in it, it's too late.
Yeah.
He said, with all the power and all the money I had and all the knowledge I had as a CEO in healthcare and having this huge career in factories, he said, I could do nothing to save my father. We need to change the system before other people come in and are in that same situation.
Blush. This is amazing. Thank you so much. I love the parting comment. Like, we're not widgets. This is not, we're not in this manufacturing line, and we're not, we don't need to be in a warehouse as a result. So I really appreciate that, Doc. And so thank you so much. Your book, I'll post it on and give a link to you and all that stuff when we post it. I really appreciate your time. It means the world to me. And I'll let you know how people are responding. Keep up with us, and we'll check in from time to time if that's okay.
Yeah, John, thank you so much for what you're doing. It's so important. It's so needed. Thank you. And
I'm so glad to help, and thank you. Hey, this is your host, Danny Mobley. Thanks for watching Humans of Healthcare. Please subscribe below for more great interviews.